section here. So now that was the nasal cavity. Now behind the nasal cavity is the start of the pharynx, which has 3 sections. We call it, AKA, the street name for it is your what?
Throat.
Your throat. So if there's your throat is the pharynx. That's divided into 3 sections. Now we'll get into the 3 sections. We have nasal, oral, and laryngopharynx. So in the nasal pharynx, which is directly behind the nasal cavity, what are the holes, the structures that are found there? Those are the eustachian tubes. From the middle ear goes down into the nasal pharynx. Now in the oral pharynx, which is behind the mouth, what structures do we find back there? Tonsils. You got it, tonsils. Now the laryngopharynx, still part of the throat, what do we find there? That's in the name.
The larynx.
The larynx, which is the voice box, or the vocal cords are found in there. Good. Right? And so that larynx is the passageway that leads into the trachea, right? So that's how we get into the actual trachea, which would be the next section. Now when we look at the actual lungs themselves, we'll just talk about the tubes that lead to it. Remember, it's about the cartilage, a lot of it. So we start at the top. So we have the larynx up there. Below that, we have the trachea, and we say that the cartilage is what shaped on the trachea? C-shaped cartilage. It's protecting the front part of that trachea. The further down that we go this tube, the less cartilage there is, guys. So when you're looking this over tonight, just know, lots of cartilage, less cartilage, no cartilage is generally how it's going to go as you move your way down. The end point of the trachea, where it ends, is called the what? The carina. It's called the carina. And then it goes into the left and right. What are they called? Bronchi. Bronchi. When they're the large left and right. Now again, which one is more wide and goes down more vertically? Which one is that? The right-hand side. So it allows for easier what to happen?
Aspiration.
Yep, choking, aspiration, bad things. Pneumonia is most likely going to happen in your right lung too. I don't think I said that in class as well. You're more likely to get pneumonia in that right side as well. And lastly, we have our bronchioles. Do they have cartilage? No. Nope. So they're the very small branches that come off the bronchi are the bronchioles that do not have any cartilage on them. And attached to the bronchioles, we have alveoli or alveoli, however you want to say them. What keeps them from collapsing? What is that substance that stops them from collapsing? Surfactant. Does it increase or decrease surface tension?
Decrease.
It decreases surface tension, because with too much tension means it's too tight and it's going to close up. So it makes them more loose, so they stay inflated. Okay. What's going on in the alveoli? What's taking place in there? Yep. This is where the gas exchange is taking place, because it connect all wrapped around the alveoli. We find capillaries that are surrounding the actual alveoli. Gas exchange is taking place, and this chapter goes over that multiple times. All right, how many lobes are on your right lung?
3.
3. And on your left?
2.
2. And there's only 2, because what?
So hard.
Because you got a heart there. Got to make room for that heart. Have a heart, guys. There you go. All right. The pleura, which is the sac that surrounds the heart, we say, what kind of pressure is inside the sac that surrounds the heart? Is it positive or negative? Negative pressure. It keeps the lungs inflated. That's what it's doing. It's keeping it inflated. If we have a break in this, that's when bad things will happen. We'll get back to that. So it's just called the pleura. And is there fluid between here?
Yes.
Yes, there's serous fluid. The serous fluid, or pleural fluid, they may call it as well, that surrounds, that's inside the sac. Prince is giving me the stink eye. You better give him his pen back. Oh, see it dropped again. Never mind.
You don't have to worry about it.
It's all serous fluid, but you can call it cardiac fluid if it's surrounding the heart. You can call it pleural fluid if it's surrounding the lungs. But it's still serous fluid. Thank you. Yes. Good question. Yes.
I thought the fluid was between the visceral flora and the parietal.
Yes, it's between the 2 layers. Yes. So it's a double-layered sac, and then between those 2 layers, there's the fluid. All right. What is the number 1 muscle for ventilation? Which one is actually making the air move the most? The diaphragm. So the diaphragm is underneath the rib cage. It's underneath the thoracic cavity. It pulls down when it contracts. So it moves downward with the contraction. Okay.